From here, we would like to start this press conference by the Prime Minister. Prime Minister will make a statement. Prime Minister, please. Before this press conference, I would like to pay condolences to those who have been victimized by the disaster of the great rain. And as a government, for the victimized people, we will be working in all might in order to save the people and to reconstruct the area where it was hit by great rain. We ask the civil people to take an activity to save your own life at an early stage. That is an earnest request from myself. And I held a task force of the pandemic and decided that Ibaragi, Tochigi, Gunma, Shizuoka, Kyoto, Hyogo, and Fukuoka prefectures are going to be under a state of emergency declared. And along with that, Miyagi, Toyama, Yamanashi, Gifu, Mie, Okayama, Hiroshima, Kagawa, Ehime, and Kagoshima prefectures, they are going to be having the intensive measures placed, and the duration starts from August 20th to September 12th. That has been approved and decided. Along with that, the areas under the state of the emergency, the 6 prefectures and the 7 prefectures under the intensive 6 prefectures under intensive measures already. These areas are going to be extended, the measures, until September 12th. All around the nation, the number of infection is rising immediately, and this is something that we have never experienced before. The new infection is rising, and at the point of last week, it was beyond 20,000 patients, and this is a critical situation. In the past, we've been able to curtail the number of seriously ill, but those numbers are rising too. And people are recuperating at home and at the recovery accommodation facilities, and that number is rising. Along with that, the health center at the municipality and the hospital's services are becoming very tight, and this is a very tough situation that we are in. The hospital, because the Delta variant is so rampant, is suffering, and the Delta strain is drawing a very big rise of the infections, and even in Japan too. It is now replacing it in fast speed. And this is bringing a total different dimension to us. Within such condition, the mission of the government is to protect the lives of the Japanese people, and even within the infection spread, the people needed should be able to go through a medical system that they need, and we need to create that system and enrich that system. The needed number of beds and the number of the health accommodation or health system should be secured. So when people are becoming sick, we will able to be handling the situation. In order to ensure such medical system to save the people's lives is something that we immediately need to work on. And at the same time, the number of infections should be drawn down. To that, we are working on countermeasures while we are working on the vaccination. Under such understanding, in each of the area, the number of infections will be counted and the number of beds used will be counted. And we have been expanding the area to have the measures. With that, in order to have people receive the medical preparations that needed, we are creating a medical structure enhanced. And in order to have that, we have been deciding on the state of the emergency declaration anew and extension, and the intensive measures anew and extension. And I am very sorry for having asking you such favor. However, along with your cooperation, we are going to be coming over this crisis, and under a strong determination, we will be building up the medical system and to prevent infection spreading and having vaccination. They are the three columns that we are going to be working on, and such column countermeasures are going to be done for sure. For the first column, this is to ensure the medical system. First of all, the people who are recuperating at home, we have to take care of them. For those in home, I think they're very concerned, they're very anxious and very bewildered. Therefore, with coordination with the local municipality organization, we would like to make a system so that the sick people will be able to call the medical system, and the medical doctors and service providers, in order for them to visit these people's homes, we will be raising up the medical fee that they are going to be providing on diagnosis. And the hospitals, we are asking the medical service providers to be coming over to a center where oxygen concentration equipment will be provided. And for those needy, we will be making the response. For those seriously ill, they should be administered to the hospital for sure. And because of that, we have been ensuring anew 1,400 beds anew so that people will be administered. And along with the cooperation with the SDF, we are going to be securing more beds. And for the lighter symptom patients, we have been adding on 1,700 beds in order for them to be staying at an accommodation area. Staying at hotels is effective in order to incur and contain the infections. We will be keeping on with that work. And furthermore, we're going to be putting in other responses too. The neutrality antibody that we have been mentioning, this is going to be administered to the virus, and it is a groundbreaking medication that reduces 70% of infections. We have the ample amount of this medical administrations insured. And so we are going to be working along with the SDF so that hospitals will be able to inject these medications. The other day, I have been visiting such an institution within the Tokyo area. Already 1,000 hospitals, 4,000 people has been administered with this. And at the site, the people are saying that the patients having administered neutralizing antibody is now becoming healthier and are able to come out of the hospital. Those over 50 years old or those having the basic symptoms, such a neutralizing antibody will be utilized. And
second pillar is measures to prevent infection. From the subcommittee, in the area of state of emergency, 50% proposal was made to reduce the flow of people by 50%. The government also looks at the areas under covered and congested areas such as shopping malls and department stores. We will be calling for reducing the flow of people. I would like to ask you to refrain from traveling and going back to hometown, and reduce your visit to congested areas by half, and seek your kind cooperation to reduce the traffic of people. At the same time, in order to prevent clusters in companies and universities, we'll be distributing the antigen test kit. And we will be having such measures, but at the same time, promoting teleworking once again. In spring last year, many companies achieved the 70% reduction in the people who work in the office. Once again, after the summer vacation, I would like to ask the companies to achieve such level of teleworking. Reduced working hours and operating hours, and also prohibiting alcohol serving will be providing subsidies promptly, and also adjustment benefit for employment we will be providing so that we can protect lives and businesses. Prefectures and municipalities nationwide will be supporting businesses. So for that, 300 billion yen of subsidy will be newly distributed to local governments. In Tokyo, every day, new cases of people in their 20s exceeded 1,000, and the people from 20s to 50s account for close to 80% of the total new cases. Infection occurs at home and also in the dining places, and the cluster in the workplace is rapidly increasing. Even when you are young, there are cases in which severe symptoms are developed and a serious sequela occurs. And also, the proportion of people in their 40s and 50s in the nighttime traffic is increasing. And increase of the people with severe symptoms for this generation is one of the characteristics of this spread of infections. In order to reduce the burden of medical facilities, and also in order to protect the life and health of all of you, I'd like to ask every one of you to have high sense of awareness and prevent any risky activities and behaviors. Wear masks and wash your hands and avoid 3 C's. Basic preventive measures will have to be implemented, and especially be sure to wear mask when you are engaged in conversation. The third pillar is vaccination, and vaccines are highly effective to Delta strain. Already, 85% has had 2 doses for elderly people, 65 years and older. And even when there's rapid increase in infection, it's possible with vaccination to prevent aggravation. So the ratio to positive cases used to be 20% for elderly people, but now has come to 3% level. And the mortality has also decreased significantly. Thanks to the effort of many stakeholders, vaccinations in June was 1.1 million doses per day, and in July, 1.5 million doses per day, far exceeding the target. In August, although there was impact of Obon holidays, pace is more than 1 million doses per day. And as of today, half of the population at least had 1 dose of vaccination, and the total vaccination exceeded 110 million doses. In various countries of the world, vaccination has come to a certain level, then there's a recovery toward normal socioeconomic activities. In Japan also, at the end of August, close to half of the population will have completed 2 doses of vaccination, and at the end of September, close to 60% will have completed 2 doses, and a level which is close to the United States and United Kingdom now. Amount of vaccine sufficient for 80% will be distributed by the beginning of October. For a long period of time, we have the battle against COVID-19, and we have been receiving kind support and cooperation by many people. But now, rapid surge in infection is causing concern amongst the people, anxiety and concern. And also the sense that it doesn't make much sense if you follow the anti-infection measures. And many people think that it's summer holiday, but what can we do? There's a sense of dissatisfaction. I understand that very well. Going forward, as vaccination will proceed to the people in the 40s and 50s and younger generation, then I'm sure that we can expect clear preventive effects, and we will be able to see light ahead from October to early period of November. All the people who wish to be vaccinated, we will be able to complete 2 doses of vaccination. That's what we aim for. The condition for lifting the state of emergency is to secure medical system, the vaccination, and the number of patients with severe symptoms and utilization ratio of hospital bed. We look at these and make a decision. Beyond that, utilization of the dining and the bar facilities and bands and traveling, recovery of social activities will be envisaged. We'll make all-out efforts. We'll do everything we can. And I seek your kind understanding and cooperation.
それでは
From here on, we open the floor for questions. And for Dr. Omi, please come to your position. And according to the contents of the question, Dr. Omi will also answer. We will appoint you. And if you are appointed, please come over to the microphone nearby. Please identify yourself by indicating your name and affiliation. First of all, calling out for the managing companies, Fuji TV, Mr. Kashima, please. This is Kashima from Fuji TV. I would like to question 3 questions. And last month, you have been saying that this is going to be definitely the last state of the emergency issued, and you have a determination. And you said that your responsibility, the highest responsibility, is to end this situation. However, the infection is spreading around. And as a responsibility of a prime minister, how do you feel? And you're going to be having an additional state of the emergency declared, an extension of such declaration. But even so, there are some point outs that you will not be able to handle the Delta strain. And for the exit strategy for next month, I would like to hear what you're going to do about after September 12th. And in the past, you've been mentioning the lockdown is not suitable for Japan. However, as one of the options, are you going to be putting it into the necessity to put it into a legal framework, or you do not think so? Please, I would like to know your intentions, please. First of all, with the prolonging battle with the pandemic, I am determined to protect the lives and health of Japanese people and citizens. And thinking of that, I've been taking on an effective measures pinpointedly. This time, the Delta strain is expanding all around the world in a rampant manner where the world has never experienced, and the world and Japan has been churning around. And with the strong determination of protecting the health and lives of the civilian, I have no changes for the determination. And within the ministers, regarding the option of setting and issuing state of the emergency declaration all around the world, that was discussed among ministers too. However, there's differences, and some prefectures are doing better. And if we're going to be having all-out state of the emergency declarations issued, then some prefectures will be in a struggle. Therefore, we came to this decision this time. And going forward, we are progressing to the exit strategy. But in order to exit, we're going to be creating the medical institutions, enhance such in order to have an exit. And thinking about the lockdown of other nations, we have observed that it has not been a determinator for stopping the increase of the spread. Therefore, we understand that vaccination and better medical services are going to be the measures to lead to the non-infections or decreasing number of infections. And for the legal framework, we are going to be discussing in a broad manner what we must do. So that is what I am thinking. Dr. Omi, do you have anything about lockdown and the exit strategy? Regarding the lockdown, in effect, the Delta strain has appeared anew. And even so, the risky condition has not changed. It is basically the same with the traditional strain. So if you are dining or meeting with people who you are not meeting regularly, or when there's a situation where you are meeting a large number of people, those are the risky timings, and that is unchanged from the traditional strain. Therefore, in order to avoid thoroughly, and if people take such measure, I think and I believe that it is possible to curtail this infection to some level, even with this new strain. So I am not considering at this point to create any situation that there is no people walking within the city. However, I would like to ask people to refrain from the risky situation as much as possible, because that is going to be a trigger to stop the spreading of the infection. However, we have a dilemma in Japan. That is about restaurants. So right now, we are putting in a system to limit the activity of the restaurants. However, we have always been asking the general public completely on a request basis. And I am not an expert of the legal area. However, there's a difficult discussions in the legal system. However, for individuals, I would like everybody in the individual level to avoid taking any risky actions. And in order to do so, I am wishing for creation of a legal framework, or else utilize the available legal framework that is already within use. I think there is a deep discussion needed nationwide about creating a legal mechanism. At least must be discussed, because there are various opinions, and I would like this to be happening immediately so that people will be discussing the issue. And that was mentioned at the subcommittee. That was also mentioned at the task force too, regarding the exit strategy, meaning that the criteria of the lifting of the state of emergency. It used to be that we were counting on the new number of infection and the burden on the medical system. Those were two very important factors, is what we have been thinking. However, the vaccination number is rising gradually. Therefore, preventing the seriously ill is becoming clear in showing effect. Therefore, from here on, the so-called the exit strategy, or thinking about the lifting of the state of emergency. Of course, the number of new infection is still going to be an important number. However, we should be thinking about the seriously ill and the hospital medications, how strained they are, and they should be taken into consideration in order to lift the state of the emergency. So as to say, the exit strategy.
Thank you. Sugimoto-san from Sankei Shimbun, please. Sugimoto from Sankei Shimbun. I have a question to Prime Minister. I would like to ask a question regarding the dissolution of the lower house and general election. You have been asked a question on this, and always you say that you give topmost priority to measures against COVID-19. Today, up until the state of emergency is extended until the 12th of September. So while the state of emergency is on, you will not be dissolving the diet. Is that the case? And furthermore, on 12th of September, if the state of emergency is lifted, immediately after that, if you dissolve the diet, then people will move with election, which may result in increase in infections. In addition, you said earlier that by early October, 80% of the people will be vaccinated. You'll be distributing vaccine enough to cover 80% of the population. Then on 21st October, close to the end of the term, you will be conducting the general election. Are you going to wait until that date? And furthermore, the presidential election at LDP, the term ends at the end of September. Are you going to have the presidential election of LDP by the end of September? If you have the presidential election, then there is an increase in the flow of people. Even with the situation, are you going to have general election on a full specification basis, including the voting by the members and associate members of the party? As I always say, topmost priority is measures against COVID-19. This is a topmost priority. As Prime Minister, I think that is what we have to focus upon. And the necessary enhancement of the medical system, and for young people, especially people in their 40s and 50s, and people 30s in their 30s and younger. For these people, we will proceed with vaccination to minimize the aggravation of patients. So that is what I have to do first and foremost. However, general election, the term will be expired, and also presidential election of LDP will take place as well. Presidential election of the party, there is a committee of the presidential election of LDP. So the election management committee will make a decision. With regards to dissolution of the lower house, I don't have, the options are rather limited. But we have to do it within the limited options. At any rate, giving topmost priority to prevent expansion of infection, and we'd like to consider these matters.
ここからは関西外の方
From here on, we would like to open the floor for questions other than the managing company. If you have any questions, please raise your hand. We will appoint you, and when appointed, please come over to the microphone. Mr. Shinohara from TV Tokyo, please. This is Shinohara with TV Tokyo. From the lack of beds for COVID-19 in the larger cities, even if the ambulance is called, the ambulance cannot bring the ill people to the hospitals. And the lack of bed was an issue that people were stating since last year. But why is it that this is not resolved even today? And in order to respond, are you going to be having a legal framework so that you are asking the medical institutions to ask them and mandate them to increase the number of hospital beds? The question goes to Prime Minister and Dr. Omi. Starting last year until this year, regarding the lack of number of beds for the ill people, compared to last year, and the number of beds were increased by 10,000 in hospitals, and for the accommodation, the number of beds increased by 14,000 beds. Those secured, but under today's condition, it is a tough issue today. That is a fact. Therefore, currently, we are going to be cooperating with the local government in order to ensure additional number of beds. And at the previous diet, we have been revising the infection disease law, and when the prefectures are now allowed to give out recommendations or requests to the hospitals in order to increase bed. And if the hospital does not follow, the prefectural level can be announcing publicly the name of hospital. But then in reality, that framework was not used so much. And according to the request of the prefectural level, the local government, the number of beds were ensured. And regarding this emergency, in order to ensure the number of beds in a more secure manner, this is something that we need to work on. That I feel very much. And other than ensuring the number of beds, the vaccination and the treatment medication, those should be going through a medical system to be used at the site. However, we don't have such a system to bring the vaccination and treatment on site. Therefore, having that in mind, this is something that we need to immediately follow up regarding the illegal framework. Today, the subcommittee for the basic policy, we mentioned about the people's individual activity, but then there was also a request for medical service providers too. The Japanese medical service providers, I think all of these people are working all-out efforts. However, for the general diagnosis and clinical treatments such as cancer and other treatments, the medical doctors working on such general treatment, but there could be some doctors who are not working for COVID-19. But now we would like to have such a doctor work for COVID-19 treatment as well. In order to have that realized, we want to have a legal framework, or else utilize the current condition of the legal framework in order for those doctors to be cooperating. And I do consider that such a rule is necessary, and that should be considered. However, thinking of those rules are not enough. And current framework, because the condition today is almost near disaster. For instance, the country is thinking about securing the accommodation facilities too. However, even if the accommodation facilities are designated as an area for people to recuperate, there are no doctors. If there are no doctors coming over, it does not make sense. Therefore, the government should take the leadership to cooperate with the local government. And for the medical service providers, I don't think that any doctors in Japan nowadays have any room, but then they have to make a stretch to provide medical services to COVID-19 too. So general Medicare supporter should provide their medical services to COVID-19 such as needed.
CBC テレビ
Yokosa-san, CBC TV, please. Yokochi from CBC TV. I have a question to Prime Minister and to Dr. Omi. In Tokai area, the measures for the areas in Tokai, so far, in Aichi, priority measures to prevent the spread of disease was declared, but newly near neighboring prefectures with industrial relations, Gifu and Mie prefectures, priority measures were issued. On the other hand, and in neighboring Aichi, and the industrial relation is there, Shizuoka, but Shizuoka is covered by state of emergency. 4 prefectures, the new cases became record high in all of the 4 prefectures, especially Aichi prefecture, more than double of Shizuoka, 960 people. So, for example, all the 4 prefectures can be covered by state of emergency. You didn't think about covering all 4 prefectures by state of emergency. And in the QA, effective measures are to be taken by the region, according to Prime Minister. In addition to Shizuoka, for example, Aichi can be covered by state of emergency. Didn't you think about that? A governor was saying that he wanted to make such a request shortly. But the processes and thinking which led to the decision this time. First, declaration of the state of emergency, looking at the situation of the region. The intent of the governor who knows the situation most. We look at that and the status of infection and the strain on the hospital beds, based upon such objective criteria, and heard the experts' opinion and made a comprehensive decision. For instance, in Mie and Gifu prefectures, it is true that a difficult situation prevails, but from the local governments, there was a request made to cover them under priority measures. The government also respect the intention of the localities, and based upon objective criteria, we made the decision. So this time, Aichi, Mie, and Gifu, and Shizuoka, we have made decisions for these prefectures as we have done. Let me also respond. With regard to Aichi prefecture, there was a particular question. We look at the status of infection and the burden on the medical system. With regards to infectious status, it is true that Aichi prefecture is corresponding to stage 4. But when it comes to strain on medical system, it is still stage 3, has not quite developed to stage 4. That is a factor which was taken into consideration. In the subcommittee today, various things were discussed, and a proposal by the government, there was no disagreement.
Wall Street Journal, Mr. Landers, please. This is Landers from Wall Street Journal. In Afghanistan, the Americans are drawing their troops, and after that, the Taliban are now taking and seizing the ruling. And so, what is your response to this, please? Japan, U.S., and the international society is supporting the nation building of the Afghanistan administration, and for that, for 20 years or over, the stability and the reconstruction of Afghanistan was worked in unity. However, the Taliban this time has been invading Kabul, and the Ghani administration is in non-functional situation. And the situation going forward is unseeable. It is very non-transparent. As for Japan, the stabilization and the reconstruction of Afghanistan is important for the local geography and the stability for the world too. That is our understanding in Japan. And securing the safety of the Japanese people in the area and understanding the situation of the world, we will coordinate with U.S. and the relative countries and to respond appropriately. That is our thinking. And with U.S., we have then alliance with U.S. and we share the value. And we have a shared value. And we have been having a relation of trust. And with President Biden, I have been committing the unshaken relations regarding Afghanistan. Responding to the Afghanistan, we are also coordinating with U.S. That is only natural for Japan to do.
それでは NHK
Mr. Osanai from NHK, please. Osanai from NHK. I have a question to the Prime Minister. Under the state of emergency, the new cases became record high, and the effect of the state of emergency is reduced. But the effect of the state of emergency and the extension of the period, what kind of indicators are you going to analyze in order to see the effect of the state of emergency? First, the infectious Delta strain resulted in the increase in the new cases, which is unprecedented. And the responsibility of government is to protect the lives of the people. To that end, we increased the number of hospital beds and hotel accommodations. And for the people staying at home, we secure oxygen station so that the patients will be able to receive the treatment that is needed for them. And the government is making all-out effort to make that possible. Now, toward the exit from the state of emergency, the burden upon the healthcare system, we pay attention to that, and utilization ratio of the hospital bed, and the status of vaccination, and the number of patients with severe symptoms. We analyze these indicators and move toward exit. Dr. Omi, do you have anything to add? How are we going to monitor? It was a question, I believe. As Prime Minister said, the number of patients with severe symptoms and the number of people hospitalized, of course, we have to monitor these numbers, but these are not the only ones. Not only hospitals, but the medical resources in the communities are strained. So in addition to the indicators that we have monitored in the past, how many people are recuperating at home and how many people are recuperating in the accommodations and how many people are being coordinated and adjusted for administration into hospitals. These are important indicators as well. So we need to monitor these indicators as well. In terms of effects, another important thing is the following. Based upon the experience, it is the flow of people, traffic of people, especially in the busy district and entertainment district. There's a correlation to the number of infections. So in addition to strain on the medical institutions, flow of people, human traffic, with that you can see the number of contacts, human contacts. So we have to monitor that as well. The details are yet to be determined. We'll be consulting with the government and experts will have a discussion to determine the details.
はい、それでは
Kuromi-san from Yomiuri newspaper, please. Kuromi from Yomiuri newspaper. Prime Minister, it is about the presidential race for the LDP. So it is a basic question. So are you going to be running for the candidacy for the presidential race in the LDP? Is that so? For myself, for the general election, am I running for that general election? There was a question received from a TV company. And when I am going to be running as such, then as time comes, I thought that it is a natural thing for me to do. So I am unchanged in that situation.
それではドワンゴの
Nagao-san from Durango, please. Thank you very much every day. Nanao from Durango, Nico Nico. Earlier you talked about hospital beds. necessity of the hospitals dedicated to COVID-19. Led by Prime Minister, you have seen results with vaccination. On the other hand, in Tokyo, more than 20,000 people are recuperated at home. There are increased cases of where ambulances find it difficult to administer patients. And the large condominium Harumi flag, which is used for Athletes Village, and 3,200 apartments are yet to be sold. So out of the 30 trillion yen deferred money from the budget of the government, you purchase these apartments, and from the sending medical professionals from other prefectures and nurses as well. You can promote digitalization so that Athletes Village can be used as dedicated hospital for COVID-19. Do you have such an idea? Another question. Prime Minister, are you going to have conversation with patients who are staying at home to see how they are recuperating? Do you have such an idea? Using the Athletes Village and turn it into a hospital. Out of the apartments who are sold, considerable numbers have been already sold, as I understand. And as for the utilization of Athletes Village, with the Tokyo government and private businesses, decisions will be made. Nationwide, a rapid increase in the new cases is observed, and unprecedented expansion of infection is observed. And what is critical is to secure necessary hospital beds and accommodations, and the people who are recuperated at home will be able to receive medical treatment that is needed. We work closely with the local government and utilize all possible resources of the region, and we are examining that every day. And while we examine, we are implementing the measures. Those patients recuperating at home. We grasp the situation of those patients, and we should have the system to be able to get in touch with them and communicate with them. So we built the system for doctors to communicate, to examine by telephone, and we work closely with the local government. Myself use online to interview the people staying at home and understand their status was a question. The person who is infected with COVID-19 and stayed home, I have heard from these people about their situation.
はい、それ
TV Asahi, Yamamoto-san, please. Yamamoto from TV Asahi. Questions to Prime Minister and Dr. Omi. The number of infection is rising, and the very big concern of the Japanese people is whether or not they can receive medical care or not. And there are some local areas where the medical system is almost collapsing. So it is not just about the number of beds, but the medical service provider and the lack of ECMO itself is a big concern. So going forward, are you really able to provide the necessary medical treatments to the Japanese people and the civilian? And are you going to be making different changes to the infection disease law? Regarding the ensuring the medical system, compared to last year end, 10,000 beds all around the nation, and 14,000 beds, the accommodation is already secured. However, the reality is very tough, as you have just mentioned. Within this condition, the serious symptom people are going into hospital beds. And for the mid-level symptom people needing treatment, will also go to the hospital beds too. Or else, for the light symptom people, as mentioned, the antibody cocktail treatment could be provided. And those recuperating at home, in order to be getting in touch for sure, the telephone diagnosis or medical doctors or service providers will be visiting their homes and to be able to contact with these people. Such a medical system is going to be structured, which is very critical. The other day, I have been visiting an institution to make a hotel devised into an emergency accommodation and utilizing the place for providing medical treatment. And with the neutralizing antibody, with these injected, this is going to be preventing people becoming seriously ill by 70%. So the government is making all-out efforts in order to do that. And it is for the changes of law, this is rather similar to the influenza. However, for the infectious countermeasure, we need to isolate the people for a necessary level. Therefore, in order to summarize this all-series event, maybe we have to think about the changing of the laws as well. And I will comment myself too. So the medical institution services are very tight and burdened. And how should we make some medical service provisions to people? And the capacity of medical system is not just about hospital. We include accommodation too. And we are increasing the capacity. As Prime Minister is said that he is discussing and thinking of various measures, I feel very strongly supported by his comment. But the necessary medical services needed at the homes is something that we must work on too. But then we have already come to this point. And then that is urging us to consider about people recuperating at accommodation area, because that is going to be much more effective. And the medical services are going to be concentrated in this facility. Therefore, for government, I would like to definitely ask the government to strongly consider and work in that area. That is the expectation of the subcommittee. And the current condition is that even if we raise the capacity of current medical services, there's limitation. And according to Japan, maybe you might not know about this necessarily, but then the COVID-19, the hospitals are increased by double compared to last year. However, Delta is so rampant that we are not catching up with the speed. That is why we are thinking that recuperating at home is very important too. But at the same time, people recuperating that accommodation facility is much more effective too. Therefore, again, I would like the government to strongly work on this issue. And from changing the infection law to Category 5 to Category 2, there's various opinion. And so there's some opinion that to change this law of Category 5 immediately. And basically, there's two reasons to be in not making this movement. And so there's one opinion that some say that this is almost near a cold, therefore we do not have to change. And the second reason is that all the medical institutions should be following up with this disease, not only the defined area. Therefore, the background is that some say that all clinics should be open to COVID-19 treatment. However, in reality, although maybe not many people might know, all the infected people are going to the hospital if needed, only needed. And furthermore, the ordinance has been revised last year, and the nation has been communicating to the hospital that even if the people are infected by COVID-19, they should not be immediately administered to hospital. Upon saying that, in today's reality, it is not exactly the same as the influenza because there could be some asymptom people. However, even the younger generation, when infected, they could become very seriously ill and have some after effect very strongly, and it prolongs even with the younger generation. This is totally different from the influenza. Therefore, right now, we are already flexibly working. Therefore, I do not see any changes needed to make for the category. However, when the vaccination is progressed and eventually the COVID-19 will be handled like an influenza, and I'm waiting for such age to come, and then we should thoroughly change the law.
はい、それでは
Two more. We'd like to limit to the next two questions. Sakubo-san from Chugoku Shimbun, please. Sakubo from Chugoku Shimbun. I have a question, Prime Minister. I have a question regarding the anti-COVID-19 measures in evacuation areas. In many people who are struck by disaster go to evacuation centers, and what kind of anti-infection measures are being taken on this point? Emergency. At a time of emergency, the clear message by the Prime Minister is called for. And your interview this time as well, you're reading out the script, and it has been pointed out. Easy to understand, they communicate in an easy to understand for the people in Hiroshima. At the ceremony of you have skipped some paragraphs in the speech. So how are you going to communicate polyglot message to the general public? First, in the emergency such as disasters, quick and accurate message is important in order to protect lives and properties of the people. To that end, necessary information is to be provided in a timely manner and clear and easy to understand manner. For instance, this time with the heavy rain, the evacuation centers are established, and every day I receive reports as to the status of COVID-19. More specifically, a distributed evacuation. We call for that, and also hotels and inns are utilized. So as much as possible, many evacuation centers are to be secured. And in the evacuation centers, disinfection and hygiene management and sufficient space to avoid 3 C's. I have been reported on these in relation to the heavy rain this time. So I have not received any report of outbreak of COVID-19. So in the evacuation centers, such measures are well taken.
それでは
Misawa-san from Mainichi Broadcasting. This is going to be our last question that we can receive. Misawa from Mainichi Hoso. And I would like to ask you about the cocktail treatment for the neutralizing antibody. And you were saying that it is already administered to 4,000 people recovering. And there is a hospital in Osaka, and the 0 patients are becoming seriously ill. However, there's a problem too. So it takes 2 to 3 days after the order, and during this 2-3 days, the patients could be seriously ill. Therefore, the hospital in Osaka is ordering beforehand, so there is a time lag here. However, looking nationwide, how much cocktail therapy is administered? That's a question. The other day, you have been visiting a hotel accommodation infrastructure. If these cocktail treatment medical medication is at hand when needed, how are you going to be creating this framework or the way to receive this? And the vaccination, you have been saying that vaccination is going to be a determinator to close down the infection rise. However, how are you going to be employing this cocktail treatment in order to also make it a big pillar? The neutralizing antibody that I have just introduced, it is going to be an infusion and is going to be administered to people in order for stopping the illness becoming very severe. This is groundbreaking, innovative, and it has 70% of effect. And the quantity is already insured in Japan for the needed quantity. And already mentioned, so in the first, there you should be applying, and then it took 3 days for delivery, but I have ordered that to stop. So for the area needed, we're going to be distributing beforehand at the necessary hospital. So I think the hospitals already have the stock at hand. So we have switched to that system anew. So even if there's a new hospital ordering this antibody, the next day the antibody is going to be delivered. Therefore, there is no lag in time. Therefore, the lighter symptom people should be not developing into the seriously symptom, especially those over 50. And those who have the underlying sickness and under 50. I think people will be able to be applied. I too have interviewed the doctors utilizing this antibody, neutralizing antibody, and doctors tell me that it has a very high effect. As mentioned, when taking this lead, it is no longer that the people have to be ordering beforehand. And so those area who needs, and they know that they need such antibody, we have already had asked them to have a stock with them. There's already 1,000 institutions utilizing such neutralizing antibody. And by these cocktail treatment, these hospitals are going to be curing the people. So I think you're mentioning about the news, 4 to 5 days old. So after what you have known, everything is developing much more speedily.
Now, those people who are still raising your hands, please send one question by email. Then we are going to respond in writing later on. With this, we'd like to close the press conference. I thank you very much for your kind cooperation.